Most nurses get into the profession because they have a passion for caring for others. But what happens when the stress of the job becomes too much? Some turn to drugs or alcohol to cope with the many stressors that come with the position.
We are Nurses Health, a multidimensional substance use prevention program for nurses. The program's approach is situated within the prevention pillar of the Canadian Drugs and Substance Strategy and aims to change the way nurses think about substance use disorders and coping with stress. Why is it important to prevent this issue? Substance use among the nursing profession is not only harmful to the nurse using, but also to the patients they serve. Drug diversion and addiction in nurses has a direct effect on patient outcomes and overall quality of patient care. So how big really is this issue? Substance use of registered nurses in Canada and the US is between 6 and 20%. Evidence suggests that nurses use higher rates of non-medical prescription drugs than the general population.
The mission of our program is to prevent substance use and addiction in nurses by providing them with education and promoting healthy coping mechanisms while reducing stigma.
The prevention component of this strategy will be implemented as part of the Nurses Health Program, a voluntary substance use and mental health treatment program supported by the College of Nurses of Ontario. This program will utilize education, peer support, healthy coping mechanisms, and the management of job-related stress to attempt to prevent drug use and addiction among nurses. Do you know a nurse who is stressed and burnt out that would benefit from the utilization of healthy coping mechanisms and the development of strong work relationships? If so, continue watching. Firstly, the program will begin by educating nursing students on the prevalence of substance use in nursing, the stigma surrounding this problem, and the associated risks, as well as job-related stress and effective coping strategies. Teaching will occur in class, with related concepts being taught throughout the 4 years and reinforced in the clinical setting. By educating nursing students about substance use and drug diversion within the nursing profession, they will understand how to support their coworkers and where to seek help. Teaching and evaluating students on their use of healthy coping mechanisms to manage job-related stress will prevent the use of maladaptive approaches, such as substance use, to dealing with work-related problems. Nurses in the workforce will also be taught about the prevalence of substance use within the profession, related risk factors, consequences, and effect on patient care. They will learn about the barriers nurses using substance face when seeking treatment due to the stigmatizing attitudes of their peers and ethical and legal obligations. In addition, nurses will learn how to manage stress effectively and where to find support. This will occur via mandatory education sessions taught by an employee of the Nurses Health Program on an annual basis. Using non-harmful coping approaches when dealing with all of life's stressors will enable nurses to come to work feeling ready to tackle their day. This training will support nurses and prevent the initiation of substance use.
Phase 2 of the program works directly with practicing nurses and works to develop coping skills by providing annual seminars about utilizing and applying healthy coping mechanisms. Nurses Health will also work directly with organizations to implement drug diversion prevention strategies to limit potential opportunities nurses have to diverting medication. How will Nurses Health support nurses to manage their stress? Staff will be able to sign up for a voluntary support program where nurses requiring extra help and support will be paired with experienced nurses. Together, they will be able to work on improving certain skills and managing stress. A support group will also meet off-site 3 times a week to discuss job-related stress. This will give nurses a safe outlet to dealing with job-related issues and allow members to support one another. Additionally, hospitals working with Nurses Health will be evaluated on their medication administration practices to limit the potential for drug diversion.
You may be wondering how this applies to the 6 to 20% of nurses actually engaging in substance use. Well, Phase 3 of the program works directly with nurses who already have an existing substance use problem by identifying nurses who may be engaging in substance use and providing screening and brief intervention. Nurses who screen positive will be referred to the Nurses Health Treatment Program, where an individualized care plan will be created based on their needs. When they return to work, they will continue to be supported. By providing training on Marlat's 8 categories and running a weekly support group, recovering nurses will have the best chance at resuming safe practice. Nurses Health will also work with healthcare organizations to implement a policy addressing substance abuse and addiction in employees. Using a clear and consistent approach in these circumstances will break down the barriers nurses have to seeking treatment. By ensuring procedures and policies avoid stigmatization of substance use disorders, healthcare organizations can promote a safe and healthy workplace culture. By supporting the transition from treatment to recovery and back to work, nurses do not have to feel alone with their addiction. They will be able to seek the help they need and ensure they continue to practice nursing in a safe and effective manner. Now, you're probably wondering how all of this actually prevents substance use in nurses. Let's apply the Nurses Health program to the stages of change, a model that focuses on the decision-making of the individual. To do this, we're going to take a look at Nurse Sam. Before she started her education in the Nurses Health program, she was unaware of the need for change. After Sam attended the mandatory education training about substance use and healthy coping, she began to consider how her actions can influence the behavior of others. She started to understand that if she shames a nurse for having a substance abuse problem, that this might deter other nurses from seeking treatment. She also started thinking about the coping mechanisms she uses and how she could improve her stress management skills in a healthy way.
Sam started to prepare to make a change in her behavior by assessing her coping strategies and planning to use more effective approaches to dealing with stress. She also planned her behavior change by evaluating her judgments surrounding substance users and how she could better support them. Sam now seeks help when she feels frustrated with a task. Instead of getting angry and taking it out on those around her, she takes a moment to consider what she can do to help the situation. She now understands the implications of addiction within her profession and has a supportive attitude when talking about this topic with her peers. Sam has continued to use healthy coping mechanisms when needed. She partakes in the nurse mentorship program and is paired with a senior nurse. Together they have worked hard to address areas of the job Sam previously found stressful. By providing education and resources to nurses, Nurses Health allows nurses to make informed decisions and cope with the many roles included in the position. Not only does it teach nurses about substance use, but it attempts to prevent the initiation and prolonged use of drugs within the nursing population. Nurses Health strives to transform healthcare organizations into supportive environments that promote the health of their employees.